Okay, Mr. Ajayi, take one.
My name is Leye Ajayi. I'm a consultant urological surgeon at St. John and St. Elizabeth Hospital. I was a hurdler, 110-meter hurdler, and I did compete for Great Britain. I would say it probably gave me the level of focus that I needed to achieve what I have as a surgeon. If you put in hard work, you get the rewards of that. The healthcare environments are such that you do need some level of resilience in how you function. I think as a surgeon, I'd be kidding if I said it was all about the surgeon. If you don't have a good team around you, that's your Achilles heel. So being able to work with the team, being able to communicate effectively with the team so they deliver for the patient. My father was a physician. He trained at St. George's, and being in a medical environment, you had constant understanding of the empathy you had to give to patients. There was always a problem with a patient, and it was also very satisfying to hear of solutions to the patients. So I was always fascinated by the outcome of those discussions from a very early age. That really influenced my decision really to become a doctor. As doctors, we mustn't underestimate how anxious our patients are. The first thing I think about really is when they come and see me is their vulnerability, and making sure you treat them with compassion and understanding, making sure they're well heard. You've got to really be actively listening to your patients. My interest in urology began at medical school, I have to be honest, at King's College. I was fortunate enough to have some very good consultants who I trained under, who were very, very committed to training, and the exposure they gave me was phenomenal. I was also present for the first laparoscopic kidney removal surgery, which was filmed by the BBC at the time. And I was present during that procedure. It was an all-day operation. And I was quite fascinated by that because the environment and the energy everybody had around the urology at the time was fascinating. So I was really pleased to be there. I do a lot of kidney stone surgery. And years ago, patients used to spend 4 or 5 days in hospital. And based on innovation, technology, if required, you can do what's called a mini PCNL, miniaturize the procedure. And if a patient wants to go home the same day, they can. A young couple engaged, newly engaged, due to get married next month, identified a lump in his scrotal area. And I saw him towards the end of the week. I examined him. It was clear to me this was a very unusual looking feeling mass, very suspicious of a testicular cancer. We were able to expedite all his investigation at St. John and St. Elizabeth. He had a scan, he had a CT scan, he had an ultrasound the same day, he had all the blood tests. Often they go for sperm banking. That was done the next day. The following day, we operated on him and removed the tumor. So I saw him 3 days after that. So within a space of a week, the histology came back. It was what's called a classic seminoma, which is a favorable form of testis cancer. Both couple were in tears. We were all hugging each other, actually, I have to say, because we were all quite emotional. They're a young couple due to get married in a month's time. Hope they invite me to the wedding. Let's see. And being in the hospital at St. John and St. Elizabeth, to be able to move things like that and expedite care was quite satisfying.